Although COVID-19 is not as hot of a topic as it was even a month ago, it's still here. Our Nixon Norman sat through Huntsville's COVID briefing today, where COVID-19 is still causing issues at the area hospitals. Nixon, tell us more.
Julia, that's a mouthful, I know, but there were a couple of topics on the table today, but one quote stood out from the rest, and it was from CEO of HEMSI, John M. Howell. He said, just calling an ambulance is not going to get you seen any faster. It's all going to be based upon your condition.
Ever since the pandemic has started, emergency rooms in hospitals have been overwhelmed. Now, 2 years into this pandemic, emergency rooms in hospitals still face this issue. And this is even happening here in your own backyard.
Many days they're just responding to one call after another. As soon as they can clear from the hospital, they're assigned their next call. And I think that's a consistent model that we have heard and seen in other communities as well, as we've talked to our colleagues across North Alabama and the state.
And contrary to popular belief, and especially now, calling for an ambulance will not give you any type of upper hand.
We're not going to give you an advantage to get into the hospital emergency room any faster if you have a low acuity illness or injury. We are transporting people daily, and if their conditions warrant, they are taken into triage and assessed by the nurse. And if their condition warrants, they may wait in the waiting room of the hospital emergency department for a period of time until a bed opens up. So just calling an ambulance is not going to get you seen any faster. It's all going to be based upon your condition.
But this is not a letter of rejection from ambulances and ERs. If you need medical help, seek it. But be aware that you'll have to answer questions so that EMS can properly prioritize patients.
So do call us when you are a family member has a serious illness or has had an injury. But if it's a chronic condition and you just decided this is a good day to go to the hospital, EMS may not be the mechanism that's best to get you there.
We have a lot of great information regarding all things COVID-19 on our website, fox54.com. So be sure to head on over there and check it out. Live in the studio, I'm Nixon Norman, Fox 54 News.